My name is Sergei Bedrikovetski, and I'm an adjunct senior lecturer at the University of Adelaide in South Australia. I'll be talking about a study called Use of the Australian and New Zealand Audit of Surgical Mortality to Determine Potentially Preventable Deaths After Emergency General Surgery. My co-authors are Helena Kopnik, Nathan Proctor, Ishraq Murshed, Johansik de von Galland, Luke Traeger, and Guy Madden. Emergency general surgery carries a much higher risk of death compared to elective procedures, but the proportion of deaths that could be prevented has remained unclear. We wanted to examine potentially preventable versus non-preventable deaths following 7 common emergency general surgery procedures. These were laparotomy, colectomy, adhesiolysis, cholecystectomy, peptic ulcer repair, small bowel resection, and appendectomy. And we also wanted to identify related clinical management issues. Using the ANZASM database from 2010 to 2022, we reviewed 4,723 deaths. Of these, 875, or about 18.5%, were deemed potentially preventable. These deaths were linked to higher rates of postoperative complications, 57% compared to 37% in non-preventable cases, and significantly more clinical management issues. Preoperatively, 38.6% versus 7%, intraoperatively, 21.4% versus 3.2%, and postoperatively, 20.5% versus 4%. The key message is that about 1 in 5 emergency general surgery deaths may be preventable. Most issues occurred in the preoperative phase. We identified 14 areas of care where management could be improved. Targeted interventions, especially around decision-making before surgery, and enhanced recovery protocols may help reduce preventable deaths moving forward. Thank you.